We're hardwired to want to protect our children, to care for them, and to want to keep them from suffering. When our babies cry, our hearts react, not just poetically, but in real physical responses to the stimuli of an infant in distress. That instinct doesn't go away just because our children get older. Infants' cries, however, often signify basic needs. Infants cry for food, for warmth, for rest, for nurture. Those are the needs that we need to address really quickly. By responding quickly, we teach our children that they're safe in this world and that their basic needs are going to be met. As children grow, however, their sadness can reflect more complicated causes: disappointment, frustration, and a need for control, among others. While the emotions that they inspire may be equally challenging to hear, the reaction doesn't have to be the same. Avoiding disappointment is not a basic need. Neither is avoiding frustration. Quite the opposite. By preventing these struggles for our children, we may actually do more harm than good. When we think about children's sadness in the short term, we want to allay it. Hearing our children cry or seeing them disappointed can just tear us apart. We want their suffering to end. But when we think about the cause of their sadness in the long term, we may not want to rush in to prevent it. A child who cries because they're frustrated may need to develop the persistence to push through frustration. A child who cries because they're disappointed may need to develop the resilience to accept that disappointment and to move on. In both cases, preventing the child's sadness by removing the frustration or preventing the disappointment steals from the child the opportunity to learn how to manage those emotions on their own. Our goal is not to keep our children from all sadness. Our goal is to equip them with an ability to respond to sadness with resilience, persistence, and hope, to believe in their own ability to solve problems and to affect change, rather than to rely on other people to prevent them from hardships. We want them to see themselves as capable contributors who can do things on their own, who know that accomplishing challenging tasks sometimes requires really hard work. So do we just ignore the crying child? No, because just as we want our children to develop the self-efficacy to persevere through challenging situations, we want them to know that they're loved and that they're supported while they do it. So when your child is sad, ask yourself whether solving the problem is both healthy and within the child's ability. A child who's frustrated by putting on their own socks, for example, may just need more time to complete the task, while a child who's frustrated not being able to climb onto the dining room table may not need your support in accomplishing that goal. The child who's frustrated by their socks would be better supported by a loving adult offering patient company and encouragement as the child struggled through the task than by that same adult putting the child's socks on for them. So instead of trying to rush in to prevent the child from being frustrated, try sitting beside them and offering encouraging words. Give specific advice on how to accomplish the task and remind the child that you believe they can do the activity independently. Supporting your children by encouraging them lovingly to solve problems on their own may take longer than just solving the problem yourself. But in the end, you'll have done more than just avoid a short-term disappointment. You'll have nurtured the self-reliant, resilient, and persistent adult who's yet to come.